Karen, how are you today?
Fine, how are you doing?
I'm good, thanks.
Good.
Hi, Carl.
Hi, Christine.
Hi,
Casey.
Carl. Hi, Casey. I made you a co-host, Carl.
Okay.
And Casey, I'm allowing you to record.
Okay.
Since I haven't done that before, Christine, when I go into breakout room 3, I just have to hit record.
Yep, that's all you have to do, and it will record it locally to your computer.
Okay.
George, I made you a co-host.
Okay, thanks.
Huh.
Can you guys
George?
hear me okay?
Yes,
Yes.
we can.
All right, fantastic.
George, you have the PowerPoint all ready to go?
I think I do. Just get out of a couple of things here. Okay, I'm going to move this over here.
Hi, Karen.
Hi, how are you?
Good.
Hey, you made it.
Yeah.
Fantastic. Thanks for being on. Really appreciate it.
No problem. I just hope I can contribute.
I think you will.
Can everyone see that?
It just popped up on my screen.
All right, fantastic.
Hi, Tom.
Morning. Good morning.
Morning.
Well, technically afternoon, but
I'll tell you, it's been a heck of a morning. I'm sorry. Good afternoon. In California, it's morning, I think.
that's true.
Yeah, that's true. It has been a heck of a morning. I've just been trying to catch up on some things from our visit yesterday, and I've been trying to chase down a 99-cent charge to the company credit card.
Keep those receipts, George.
Well, it was for a subscription for it was for a local newspaper, the Something Tribune, but it had the Macomb Times on it, and it just, what a mess. I just frustrated. Ellen understands that. You got to have the receipt, right? So did everyone see the governor's back to school plan?
Yep.
All 65
63.
pages of it?
Yep.
That was painful, but yeah.
Yeah, I read through it this morning and it's like, so just so that I'm clear, is the entire state is in stage 4, right? Or step 4, whatever she calls it.
Yeah, there's some UP, and there's 5 counties in the northern region that are on phase 5.
On phase 5, okay.
My understanding, yep.
So schools are good to open and have in-class instruction as long as you follow the must-haves.
Mhm.
Right, the requireds, yep.
And then there's the strongly suggested or recommended, and then just recommended.
Right.
Strongly recommended, yep.
Do you think parents are going to be satisfied with that? Hard to say.
I was looking at some Facebook comments today, not on our school page, but just I kind of stalk people. And with the comments are just, that it's trying to look at as another set that for the most part were positive. It's another set of rules that we need to follow. Homeschooling didn't work for us. We want our kids back. So, I mean, you're going to have both camps on it.
Right. Hey,
And I think
Greg,
practically speaking, we're probably most likely going to be in phase 5 when we
Right.
actually get back to school. So
Yeah.
this is a question for both Ellen and Karen is that, I mean, there's a lot of work for phase 4 is the most onerous as far as I'm concerned.
Yes.
A lot of work. So how many calories and how much money and how much time do we spend on phase 4 when we're pretty sure it'll be a phase 3 or phase 5, right?
Right. I don't know. For us personally, I think we need to, at least in terms of the principals and our teachers, need to be focusing on that phase 3.
Yes.
Phase
I'm right with
4
you.
Phase 4, I'm leaving more to, I mean, obviously I would help with that, but our facilities people, our maintenance people, a lot of work from them on that.
Well, there's a lot of mask usage in phase 4.
Yep.
A lot.
Yep.
So
thanks, Greg. He was sideways.
It's on my phone, and I'm not sure that I have a way of rotating it on the Zoom app.
Okay, I put that up there so you could see yourself.
So Ellen, how are you?
Oh, pretty good.
Good.
Can everyone see that screen?
With the confirmed cases, yes.
Yeah, this is something our GIS department put together, and it just looks like there's this huge spike here. And I don't know what the anomaly was there, other than I know that they were going back and re-looking at cases. And there was a lot of additions at some point, and I think it was right about here.
Right.
But you look at this and it's staying pretty flat. So I was just trying to understand whether or not I think we'd end up back or that we would end up in phase 5 of this. So it looks like we're trending the way the governor wants us to trend before she pulls the trigger on that.
I hope so. I mean,
Me
she's
too.
reading a lot of newspaper articles about like Texas where they're, closing restaurants again, and Florida where it's just got to be a tough gig right now to be governor.
Mm-hmm.
No matter what you do, you're either right or you're wrong.
And if you're wrong, you don't want kids and other people to be affected and hurt. That's the
Right.
problem.
I've had a lot of empathy for her because it's been hard enough in our position. I cannot imagine being in her position.
No, not at all. I think there's more pressure for governors right now than there are for presidents normally.
I agree.
I think you're
Unbelievable.
absolutely right. All right, so is everyone ready for the 90+ degree days for the next week?
If it kills some of the COVID, I'm all for it.
Right.
Yeah. My son works for the National Weather Service. He's a meteorologist, and he says, Dad, I know you don't really like the heat, so you better hunker down in the basement because it's going to be hot.
Luckily, it's not a problem these days.
Yeah. So,
Ellen, could I have the exact how you prefer your last name? I think I know what it is, but could you tell me so I don't mess it up?
I pronounce it Hasse.
Hasse, okay. So one thing I hate is pronouncing last names wrong.
all right, so just a couple more minutes and we'll start letting folks in.
I was on the phone from 9 until 5 minutes before we got on today, so it might be a light turnout today, unfortunately.
Yeah, everybody's
room.
got their
Yeah.
hands full or on vacation or.
Yes,
They're scrambling with that report from yesterday.
we do tape these, so they're still important for people to look at later if they'd like.
Okay.
Yeah. So who's going on vacation this summer? No?
Not likely.
No,
Yeah.
just, I'm trying to take a couple days here and there.
If you
Yeah.
do, you're still not on vacation though.
Right, no.
Yeah, I was supposed to be in Europe right now,
Oh, no.
Wow.
visiting my mom and dad in the Adriatic. So at least I've got blue sky looking out my window.
Yeah.
As long as I look up, I feel like I'm there.
Yeah.
Oh,
Let me know when you'd like me to admit the one person who's waiting.
we only have one person waiting?
Yes.
All right, well, let's go ahead and let them in.
Okay. Hopefully more will arrive shortly.
Hi, Aaron. Oh, still connecting. Hello, Aaron. Are they stuck on mute, Christine?
I unmuted Aaron.
Okay. All right, well, it's 1 o'clock. Well, why don't we go ahead and get started? So as an icebreaker, we've put this cartoon up and we'd like you to maybe just make a comment in the chat box regarding what other things are we not thinking about in terms of cost beyond maybe just dollars and cents before we begin reopening schools. So as we're waiting, Aaron, can you unmute your mic? Like it's stuck. Okay, well, let's keep going. My name is George Kakan. I'm a regional director of architecture for Wightman. I'm also a recognized facility planner, and I'm going to be your facilitator for today's town hall. The reason we have started these town hall meetings is because in these unprecedented times, superintendents are being involved in a lot of different situations that they've never had to deal before. And we wanted to provide a forum for superintendents and others in the school business to be able to share best ideas and best practices. So for the next 45 minutes, that's what we're going to do. So the panel discussion today is really going to be focused around returning to school and planning to return to school. We know that we got the governor's report yesterday for returning to school this fall. And we wanted to really kind of hone in on the implementation and the cost to implement all of those things in order to keep our students and our staff safe as we begin school in the fall. So just recently, the Government of Accountability Office has put out a report, and they've noted that there's about 36,000 schools nationally that have inadequate health conditions to reopen. Hopefully we don't have many of those schools here in Michigan, but things that were cited were like water faucets and inadequate ventilation. All of those things are going to take time and money to correct in order to provide a clean and healthy environment for students to come back to school. So the three things that we're going to maybe go out into breakout rooms, or depending on how many we have on the call today, is the first item would be is how are you going to adhere to the health monitoring and cleaning, especially based on the must-dos by the governor yesterday. What additional staff will you need to employ and implement safety protocols? As an example, how do you check students before they get on a bus? Does the bus driver do that, or is that an aide? Or how will you provide PPE, transportation, and childcare as students come back to school? So with that, I'd like to introduce Dr. Tom Langdon. He's a part-time superintendent and mentor for Walkerville Public Schools. He's also an educational consultant for Wightman. And he's served on many boards and on many committees. So with that, Tom, welcome. And I'll let you take over. Thank you.
Thank you, George. I appreciate that. Today, we're fortunate to have two outstanding leaders from the school central office area, one a superintendent, one who is a school business manager. The first that we'll discuss and welcome is Karen Weimer, who's the school superintendent of Brandywine Community Schools. And I'll let her say a few things about her experiences and what makes her perspectives unique during the show today. So, Karen?
Hi. As said, I'm Karen Weimer, and I'm the superintendent at Brandywine. And those of you that don't know where Brandywine is, because we are not a town, we're located in the city of Niles. We're right on the border of Indiana. In fact, we get all of our news from the Indiana news stations. So I've been 32 years in our district. I've served as a 5th grade teacher, a K-2 principal, and then now starting my 4th year as superintendent here in the district. And each position has given me a unique perspective. So I think that helps me as we're moving through all of this, because I do understand the different areas. And I also hope that I build up some trust in the district, and that people trust my word that if we're doing things, that if I say we're doing things, we're doing that. So I'm happy to be part of this panel today.
Fantastic, thank you. And our other guest, who is again works as a business manager, is Miss Ellen Hasse, and she is actually has been in that role for some time now, but she has had multivariate roles as well within her district. So if we could have Ellen, first of all, welcome, and if you could say a few things about your experiences leading up to this point in time that we're dealing with, that would be fantastic.
Thank you. I work at Berrien Springs Schools, which is about 10 miles north of Niles. So Karen and I are pretty close together in the same county. I've worked in central office for 32 years. I started as payroll and part-time food service bookkeeper, and pretty much done every job in central office or been involved in everything from pupil accounting to everything. So I look forward to discussing all these new changes and guidelines with everyone.
Well, I think it's great because, you know, having those kind of perspectives and two people that have actually gone through different roles, several different roles within the district, I think is incredibly powerful as we, you know, talk about the issues that we're dealing with today. So first of all, one question that we have so far, and it is, I think, very pertinent, is when we're looking forward. And again, we've gotten two documents that are probably some of the most important in the last 3 months, in the last 2 or 3 days. One was the budget piece, and the other one is the roadmap. So, but the question that's popped up here, and Karen, you asked it, how about if you help answer it a little bit? The possible cost for assessment. That's what you get for asking a question.
I was putting that in the chat of things that we hadn't thought about. My special ed director has been talking to me, you know, about the loss of learning that our special ed students have. You know, are we going to have to be offering extra instruction for our students? And so there's the possibility of that added cost there. And, you know, obviously we're going to assess our students when they come back, but what will that bring in terms of instruction?
And that's a smaller piece of a more general question of just the extra work and planning that's going to have to occur next year. If you could help us understand from the superintendent side, what that means to you right now, and has the last couple of days helped inform a little more in your position as to what we have to do next year, or what we should be doing next year as school reopens?
Oh, it's definitely helped. I mean, still a lot of unanswered questions, but I feel it's given a lot of guidance to what we should be doing, what decisions we should be making. I see extra costs even in terms of my administrators, because this is going to require a lot of extra work, and my administrators are now off technically at this point. Yes, they have, you know, their days to cover them for the school year, but I need them obviously at the end of the school year as well. So I've talked to our business director about possibly compensating people extra for their days. Same thing with teachers, that we're expecting them to do work over the summer, and we need good quality plans, and that takes a lot of time. And so those are things we need to consider.
Yeah, one thing we did learn is that we have connectivity issues, we have one-to-one, you know, computer issues. But one thing we also learned, I believe, is the whole professional development to have teachers get ready, right? That's going to be a huge issue this summer, right?
Yes.
Yeah. Okay.
And,
well, go ahead.
I was just going to say, in terms of professional development, I think it was moving to that remote learning was wonderful, and it forced people to do technology that maybe they knew was out there, but they really hadn't done it. It made them do things, it got them better, but also provided more teacher experts than what we thought we had, because we weren't sure how things would go, and went surprisingly well. Certainly can do better. But from that, that's how we're going to frame our professional development of what did we find out from our last experience? How can we make it better, and what professional development do we need to do that?
Absolutely. We could talk a lot about flipped classrooms and that kind of thing, but maybe we should go on to our other guest here, Ellen. And thanks again, Ellen, for joining us. Could you give us your ideas in a broad question about the additional costs and how we're going to take care of those things as we move along?
I guess mostly the cost for, there's several levels of cost for cleaning, the supplies that are going to be needed for personal protective equipment, and even the availability of that much. If, you know, like, are you even to be able to procure that much? And I guess just I think the transportation part is not as bad as we thought. It looks like as long as they have masks on,
Right,
that they'll be able to, you know, ride buses. But just I think just the extra cost in everyone having to monitor all of this stuff too.
Right. But, and I agree. I think that when we're looking at this, you know, I think that we can all kind of look at these levels, and it seems like phase 4 is the one that might cause us the most distress right now. And because, you know, phase 3, we kind of lived through that a little bit. We would like to spend a lot of time on the phase 1 through 3 to get, you know, because we do know the value of having online in case we have to close down for a week or whatever. We felt fairly confident that we'd be going to phase 5, maybe even before July 4th. That's not going to happen now. So this is really a moving target as far as costs go, isn't it, Ellen? And that makes it tough for a business manager who likes to kind of have things in line pretty well by midsummer, right?
Right, and probably not so much cost, but just how do, like she mentioned, maybe moving some of the sports seasons around.
Yep.
Just the logistics to do that now when most schedules are already in place.
Boy, you just touched on one that could be a whole show, couldn't it? As far as, you know, how do you do 2 days for football? How do you, let's not even touch that one. We could probably spend a lot of time on that one, but that's a great point you're making. Just how do you budget for those things, and how do you get ready for it? So let me throw one here at Karen about the fact that the budget piece looks like we're getting the proration, but we're also kind of getting the backfill plus some with the, you know, with the additional federal funds. How are you approaching those funding things? And nobody has the right answer here, just ideas, right?
Right. At this point, we're keeping everything COVID related separate and trying to plug that into whatever grants or money that we get, so that we're able, when things are available, that we have that there ready to go. So that's currently what we're doing. And just, we have I was talking to in Berrien Springs and Brandywine share the same person. We have somebody that supervises our projects, and he's already starting a spreadsheet for different buildings of what all kind of PPE we need. So we're just trying to get preliminary information right now based on what we learned yesterday with the roadmap.
Great idea. So you're looking probably the phase 4 is going to be the one that's going to probably be the most costly and probably the most intricate as far as all of the phases. So you're already looking into what might have to happen if that were to occur.
Yeah.
I mean, we're all praying that
Right.
we don't hit that, but it could happen. So, all right. So Ellen, as you are considering all of these, you know, the budget issues and everything, are you considering the fact that there may be another stimulus offering? And I'll say this, I don't want to put you on the hot seat, because I really think there probably will be another one in late July. But how's your school? Are you looking at having some extra funding from that to help ameliorate some of the costs going forward, especially in light of the House of Representatives thinking about an $800 increase to help start schools up again?
Well, cautiously, we're looking at that. It depends on what kind of restrictions that are going to be put on those funds to spend them. Hopefully they'll still include that we can spend it on technology. We always have needs there to, you know, replacement cycles and everything that we've had to put on hold now for some of our computers and replacements that we were planning on purchasing. I'm hoping that we can use some of that money for that.
Go ahead.
MSBO sent out a good PowerPoint this morning that it was titled Fiscal Year 20 Budget Agreement and Michigan Safe Return to School Plan. And it just kind of outlines some more of the budget agreement. And one of the points in there said there's still additional $60 million in categorical reductions that still remain to be decided for the fiscal year 20 budget. So I still am cautious because I don't think everything has been, really cleaned up on that yet.
Yeah, and $60 million equates to, I guess, right around $30 or so per kid. And that's a substantial amount of money, not knowing what area that's going to be taken up from as far as the categoricals. So that's a tough one too, trying to pocket that away, trying to decide budgeting and all of that. Totally agree on that. Moving forward then, as we look at next year and we look at the situations coming up, are there any projects that you hear not even just your own schools, but any projects that are obvious things that should be done immediately that are physical things like with having one way in hallways or having physical barriers being put up or the plexiglass? Are there some commonalities you're hearing around your region that people are talking about and saying, yeah, that makes sense, we should all just kind of do that piece anyways, or are we still on the front end still? And that could be for either one of you.
I feel we're on the front end. I know our county superintendents are like I said, meeting once a week. We were supposed to meet tomorrow, but we kind of delayed it a little bit because of the holiday and also because we just received the roadmap and we're meeting next week. And I think to talk about those things, but what you said makes sense. I see that elementary schools the kids are pretty well trained in the hallway of which side to walk on. Middle school, high school, not so much. So see things there, but those are definitely things to consider.
Right, it'd be nice to have, go ahead.
Well,
Ellen, yeah.
especially in the offices, I think
Yep.
that barrier, because they get
Yes.
so many different people in coming into the office,
Yep.
probably would be a smart thing to install those right away.
Right, regardless, because some of those things are probably going to be best practices for a while. As the vaccine, we keep hearing Dr. Fauci say that vaccine is going to be at least late December, early next year if we're doing really well next calendar year. So those are the kind of things, if we can maybe get some commonality. So, I think it always helps, and most of the schools, at least in our areas, are doing the same thing so that there's the same response and we can educate parents and students in a way that's very similar. It's never a bad idea. I don't believe anyway. So as we move further down the line and we're looking at the complexities of all of this, I really like, Karen, what you're talking about, kind of like a if-then or a Venn diagram of what things that we are big picture things that are going to have to be done. Do you anticipate, we talked a little bit about sports, we don't want to get too deep into it, but do you anticipate, Karen, having sports of some kind? My understanding is, and I read this quite a bit, but I don't have all the answers, obviously. It looks like phase 5 will be able to have sports in a pretty similar fashion to what we're used to, with some caveats. Is that something that you're anticipating, hopefully being able to do when school starts up?
Oh, obviously hoping that. I just, what kind of parameters are going to be put on that? I don't know. I know in terms right now with the conditioning that our students are doing, we've talked at length with our athletic director that, this is kind of showing our families, that we're taking this seriously. These are the protocols we're following. And if we screw it up, going down the line, we could have issues. So just to make sure that we're following everything, and so far, knock on wood, everything's gone well and people understand and people are following what our guidelines are, and which obviously are based on the guidance from MHSAA.
Right, and it was very clearly stated in the roadmap that they're going to be looking very strongly at what MHSAA has to say, and I think that's unbelievably important. Yep. But there's things in there like not being able to lift weights indoors, doing conditioning outdoors. Right. Things it gets pretty specific within this roadmap of what we can and can't do. And to me personally, as a superintendent, it almost gives you some relief to be able to have some definitive things that we know we can and can't do. So I agree with that 100%.
I totally agree with that. I was relieved to see it was a lot more of, I don't want to say thou shalls, but more of that than I thought there would be. So I do appreciate that, because that just makes it that much easier to make decisions. And
show people that this is kind of the law of the land now. And it's,
and that our district's doing it, the next district's doing it, everybody's doing this. It's not just something we decided to do.
Right, absolutely. And Ellen, if you'll let me, have you get your crystal ball out, and if you don't want to answer this, it's okay. But as far as the flexibility, I think the biggest question right now, I think we might have touched on it, is the flexibility piece with the funding that we're going to be getting, that we heard about on Monday. What are your thoughts that it's going to be fairly close to the CARES Act funding that we got? That's what I'm kind of hearing some intimation about. But what are your thoughts on that? Do you think it'll hopefully mirror some of the guidelines behind the CARES Act funding?
I'm thinking right now, probably there's going to be some kind of restrictions from what I've heard. They really don't want to, the feds don't really want to backfill revenue to the states for mismanagement on some of the parts of some states, not all states. And like, I'm sure some states aren't really going to need that much backfill, that they'd be fine. So I'm sure there's going to be some kind of restrictions or guidelines to use it.
More so than the CARES Act offered?
Hopefully not.
Okay.
Hopefully there's some flexibility on the state's part too, if you can justify that it's somehow related to the, virus issues.
Right, right. George, you had a question, and I think I know what you're saying, but maybe you could voice it, because I'm not totally, do you mean, you don't mean student retention, but I'm maybe not reading it totally.
Well, I mean, it's actually, I've got a couple of questions. So the first question is, and I think our guest touched on it earlier, is in terms of, kids being out of school, being away from school, how much did they actually retain, and how much effort is going to be involved to kind of get them back up to speed and on track again, so that they're, that they're tracking, at the grade level where they're supposed to be. Because I know from personal experience, when I was in the 5th grade, I was probably, I don't know, half a year behind, and I had to make it up in the following year. It was pretty tough on me as a student, but I just remember having multiple teachers involved in trying to get me back up to speed. So there's got to be some type of cost involved there, and who benefits and who suffers. And then the second question I had, and it's not related to that, but it comes from the governor's roadmap, and that deals with, and this is a requirement if we're in step 4, which is screening students and staff. And I don't know how you want to handle those, but maybe take that question first, is how are you going to accomplish that? How are you going to keep all those records and things?
How about if we do this? How about if I have maybe Karen take the first one, but I'll follow up with a second one, because that's probably a lot easier.
Yeah.
the roadmap is pretty clear that you're gonna have to talk to your local health department, and they will give you an idea of, so that it'll be a little different as far as testing across the state, from what I can understand. You'll be talking to your local people there. So in our case, it's about a half a dozen counties, District Health 10. So we're actually going to be meeting with superintendent, meeting with the medical director from the health department next Thursday to ask her some of these questions. I'm guessing, now I'll throw it off to Karen. I'm guessing that probably you're going to be, talking to your health department leaders as well sometime in the next whenever. So.
Yeah, and that's the meeting I referenced. That's going to be next Tuesday, similar to what you were talking about, Tom, is that, our health department is going to be there. We're very fortunate that our a representative from our health department was on Governor Whitmer's task force. So she's got firsthand knowledge of things that went on. And there will be lots of conversations with them. And fortunately, we've got good relationships with them. But moving on to the second part of how are you going to keep record of that, goes into our added costs. I know, speaking for at least our elementary schools, we have one secretary per building. How are they going to do their own regular business and then keep track of all the other stuff, and when sick kids and things like that? And it's do you hire a nurse? If one's even available? I mean, there's a lot of questions in that area for me.
And if a child is sick, you have to get alternate transportation back home and make
Yep.
sure the parents are there.
Yep.
And then if you're actually driving the student home, do you have to quarantine the rest of the day? There's
Right.
so many parameters. It's really, I think it's going to be everybody's hope that the phase 4 doesn't come into existence.
Right.
3 is actually probably easier than 4, actually. And then in 3, we're going to have to use probably during the school year. So at that point, we'd really like to put a lot of training and effort into what 3 would be all about.
Yep.
Because 5 will be relatively simple, not simple, but a lot easier than 4 by any stretch of the imagination.
Yep.
But it's a good question, George, on the retention piece. What I would say is that that's why stage 3 is so important to go for, because you can use those skills that teachers get as far as online teaching. You can use those over the summer, over the next summer. You can use those after school by connecting with students. There's a huge amount of profit from being able to actually get ready for that stage 3, because it can be used beyond. The stage 4 is going to be a lot of we'll use it and then just not use it anymore type of thing. It'll just be a disruption for kids. I don't want to let Ellen off the hook here by not having her talk for a while. But are you, I know you don't have a definitive answer for this, but are you pretty much planning on trying to get as many of the personal protection equipment, the face masks and that kind of thing? Or maybe waiting until do you see what other schools around you are doing, or wait for more indication of where we're actually going to be? Because it is still early in the game to say we're not going to hit phase 5, right?
Right. Well, our head of maintenance is already looking at different places where he can order and like kind of getting an order together right now. So he's ready to hit it when we need to. And for the health screening, I got an interesting email the other day. It's a company that we already use they pick up our mail. It's called the Marana Group. And they have this program called Health Screen that sends a daily text message to every employee that they have to respond to with a questionnaire. And then it tracks and documents everything for health screening for employees. I thought that was something we might look into.
Right. Yeah, it's almost like, until we talk to our health officials, our district health department officials, it's going to be kind of a guessing game. So I think that's why you see the fact that Karen will be going, and other superintendents from her region and mine as well. I think that's going to be going around the state. They're going to be very popular people for a while here, I think. Mm-hmm. And rightfully so. They do a great job for us. I was going to ask George, do you want us to go into we have a smaller group, and we've had this before in one or two situations, and we just kind of open it up to everybody to talk and to just have a group discussion for 5 or 10 minutes or whatever, and then do a wrap up. Would you rather do that or go into whatever you think?
I think because the numbers are small today, let's just stick with the group and let's just have a group discussion. I think that'd be a lot easier.
Okay, all right. Maybe have people that are on the call that haven't introduced themselves. Maybe if they want to introduce themselves, or if they don't, that's okay too. So
I am unmuting everyone.
Okay.
If you're still muted, it's up to you to take your unmute yourself.
So is there anybody else on the line that might want to introduce yourselves? If not, we'll just start the conversation.
Okay,
I can introduce myself. So I'm Casey. I work for Wightman. I head up their interior design department. I'm also a mom of 3 elementary age kids. So I really enjoy sitting in on these town hall sessions to hear kind of the feedback and gather everything.
Thanks, Casey. Yeah, just as a follow-up to that last question, I know that as a company, we're going back in multiple stages, and we're on July 7th, I believe, is the second phase that's coming back to work. And so if you have to go out on any kind of business or go into the office, our GIS department had developed an app that we use to be able to do the health screenings and then collect all that data so that if we do have to follow up if someone is sick, that we have the ability to do that. It's a lot like the items that you were talking about, Ellen.
Okay.
So, and it seems to work really good. I mean, most people, if they remember to do it, and I'm just as guilty as anybody else, I try to remember to do it every day before I come in the office or go out anywhere. But it's relatively quick and it's pretty painless, and it doesn't put a lot of burden on any of your administrative staff. I'm guessing that if we had to track some things down, that would probably take some work, but it's all automated, so it works pretty good. So you may want to talk to the health department about, you know, what kinds of things they have out there to help track that. So I'm just going to just quickly jump through a couple of things. Obviously, we talked about, you know, reopening schools safely, and you know, this article, there's so many articles out there. You know, the most important piece that all our school districts in Michigan need to follow came out yesterday. So hopefully everyone has that, has had an opportunity to read it. I read it this morning. And I would agree with, I think, what you said, Dr. Langdon, that phase 4 is probably the toughest phase in that whole document, based on the required things that school districts are going to have to do. And hopefully we'll be in phase 5 by the time school opens, so that it makes things a little bit easier for everybody, but still remembering to be safe. You know, there's been from the different political groups, you know, how much money should we put into reopening schools? I think there was $59 that, you know, this report cited about potentially providing school districts. And then going back to that report from the GOA, they did a study on a school district, a fictitious school district of about 3,650 kids with 8 buildings, 183 classrooms, about 330 staff members and 40 school buses, and what the cost would be to follow guidelines similar to what our governor put out yesterday. And I was just shocked at the number that came out, which was almost $1.8 million for that school district. And I'm guessing that the smaller the school district, the per cost per student would go up, and maybe the larger the school district, it may go down.
One point of clarification on this, George. This particular study you have up on the screen was actually jointly done by AASA and ASBO. It was not by the federal GAO office.
Thank you for clarifying that. And they referenced this. I misspoke. They actually referenced this in their communication and their report.
And what I thought was interesting was the biggest share of those costs went into the additional hiring of staff. If you look at that second column, the hiring of staff to implement health and safety protocols, those are the big ticket items that push it up to nearly $1.8 million. And a big question I would have, are these staff even available for hiring? I mean, can you
That's
go
a good question.
full-time, part-time nurse for every single public school to add in, or adding in an aide for every single bus that's able to do the screening on temperatures and things? And, you know, are those people that have the skills that can be readily trained, that are available, can they be hired that quickly and have them placed by the start of school?
So they must have meant like one nurse or full-time or part-time nurse per building, right? Not.
Yes.
Yes, and that's what it says. The $400,000 in that second column is ensuring at least one full-time, part-time nurse in every public school building.
And you know what, maybe
Also-
Karen or Ellen can help me out here, but there's at least 3,000 or 4,000 or so buildings when you look. I mean, we have 700 districts, and then we have all the elementaries. Some are multiple high school buildings. We've done this study before. We've seen more than one study in the past that says that you could not have even districts right now at 800 almost nurses. And under these circumstances where nurses are at a premium at this time,
Right.
it would be undoable, right?
Yep.
Yeah, because most districts don't have any nurses right now, right? I mean, we're fortunate to
don't.
have a part-time nurse for the whole district, but
We have a consultant, so.
Yeah, Ellen, you're very fortunate to have even a half-time nurse. It's been, in my career of 30 years now, I've been in one district that had one nurse, and that was Beaverton Public Schools way up north. And it just worked that way for them. But that was an anomaly. Yeah, it's unfortunate too, because nurses can help in so many ways. I mean, but even just procuring one would be nigh to impossible, I believe nowadays, especially for rural schools. So,
Even more expensive than the nurses, though, is the cost of the additional custodial staff to be able to do the cleaning and disinfecting of both the schools and the buses to prevent the spread. They were putting that at over $400,000 for all of the cleaning staff. And then
right.
the next biggest item is resuming the before and after school care, child care programs with social distancing and additional cleaning protocols for before and after school. That's $168,000. And then things like getting a fog machine cleaner, for the buses to be able to go through and fog the buses and disinfect them for transportation. That's over $50,000. So some of these are fairly big ticket items. And then when you look at it, I guess it's the fifth biggest cost item are the disposable masks for the students. And that's just getting 30% of the students masks, not even all 100%, but providing 30% of the students masks in a district of just about 3,700 students. That's almost $150,000 for that alone.
Unless I'm misspeaking, phase 4 requires even K through 5 students to have masks in common areas. So they're still going to have a mask. And all adults will have to have masks.
Mm-hmm.
And you can't switch classes without disinfecting. The list goes on in phase 4. It's onerous to say the least. And those are the required things, They're not just the recommended things.
Yeah, as an example, with the masks, it states that you could wear a reusable mask, but that it has to be washed every day. I mean, who checks for that?
Yeah.
And how do you know that it's been washed? I guess if there's peanut butter on it, it has not been washed.
Well, they used to have that cloth that if it was colder, it would wasn't there a cloth, the shirts that kids would wear that if it was colder, it would, change colors? Maybe if you wash it, it'll change colors. Maybe that's the answer. I don't know. It's a brave new world, though.
So to the two, actually 3 represented school districts here that I know of, are you anticipating hiring any additional staff to cope with this, or are you still going to try to wait and see if we end up in that stage 5?
I'll foray into that.
It's a tough question.
Yeah, what I'll say is that we are anticipating phase 5. However, if that doesn't happen, if phase 4 happens, then we would probably have to do some things that would be unique in order to deal with the situation, but not having to hire too many people, because quite frankly, there's not many people to hire right now. I mean, there are people that are, laid off for sure, but to hire people well, yeah, and the thing is that you have to make sure you can do the criminal record checks. You go through all that. Some people don't want to do that for a part-time job. There's some ways to ameliorate some of these burdens, like have the bus driver actually clean the buses after their use, those kind of things. So there are ways to take care of some issues, have custodians or having parapros on the buses that are already working that day. So there's some ways you don't have to hire new people. But, you know, if you did phase 4 all year long, I think I'm not going to speak for our two guests, but if I knew I had to do phase 4 all year long, then I definitely would be looking at doing some hirings.
Oh, yeah.
And that group of people is going to come at a huge premium because then everybody's going to have to do it.
Right. Right.
Wow.
It's going to be catastrophic. Phase 4 is going to be, let's just hope it doesn't happen.
Yeah.
Well, you saw the chart earlier. It looks like we're trending in the right direction here in Michigan, that hopefully we'll be able to flip over to 5 like we have in some of our, in the UP, as well as in some of our northern communities.
We have every expectation, right?
Well, I've got my fingers crossed too, because I'd like to see the kids get back to school. I just know how difficult it was for me, having fallen behind that 1 year, that 6th grade. I think that changed my life, because that for me was the turning point where either I was going downhill or, you know, I was going to keep climbing.
Yes.
And luckily I had people that cared enough that, you know, helped me get through that. And, you know, I've been grateful ever since.
That's what good quality teachers in schools can do for people, and what they should do. And that's kind of the scary part of the social emotional of kids saying, stay away from other kids and having masks on. They've done studies that it's not good to make every kid wear a mask. It's not socially and emotionally good for kids. So let's just hope phase 5 is the reality.
So in phase 5, as we're talking about that, I'm just trying to remember, then you could go into schools without wearing masks. Is that correct? It's optional?
Much more, it's much more, it's much easier than the phase. There might be some things like some busing issues. There might be some issues there. And, you know, there's, you know, phase 4 is the long piece here.
Yeah.
And then, yeah, in phase 5, I think, and I didn't write down each separate one, but yeah, it's when you look at the required, under cleaning, there's 6 bullet points. Under athletics, there's, you know, 12 bullet points. It goes on and on with the, you know, as far as being able to have assemblies in your school. And then phase 5 gets much more noticeably less egregious.
Yeah, I'm just going to throw this up on the screen because I do have this up. So these are my cheat sheets. But yes, in phase 5, there's a number of things that are strongly recommended, but I don't think there's anything that's absolutely required. Not that we shouldn't be doing that.
Right.
But you're right. It is less stringent. So let me just.
Yeah, you're right. And as you go on to page 43, 44, you got to look deep to find the required stuff. You know, and it's not that we shouldn't do some of those things with, you know, you have to have, you know, talking to people from a health department, but the idea that we can do it in our own unique ways is so much more liberating for schools.
Agreed.
And hopefully they'll do the phases more by location of county instead of like bigger regions, you know, lumping bigger regions together.
Right.
Some of the counties are lower, but they were placed into a region that's higher.
Right.
And Karen, correct me if I'm wrong, but my understanding is that big piece that Ellen so rightfully said is tough, is those are hospital regions, right? So.
Yeah, I think right now it's like more geographic. I think you say hospital, like we've got County right beside us, and they have significantly less cases than we do in Berrien County. So, you know, like Ellen's saying, we're all different, even within the regions.
So we're lumped with, Walkerville's lumped with Grand Rapids.
Oh.
so that tells you how that would work.
Yeah.
So anyways. Are we gonna do this for 145 or the whole time?
No, I think we're done. I said we're going to go about 45 minutes, and so we're right at that 45-minute mark. So what I'd like to do is I'm just going to flip through these just real quick. Since we didn't have our breakout session. So I just wanted to thank, number one, our guests for participating with us today. I think I've learned a number of things that I didn't know before, so thank you for that. And then, you know, from the standpoint of, you know, how are you going to adhere to the health and monitoring and cleaning, I think there's a lot of ideas out here, and that it is going to be a lot of additional work, but it sounds to me like everyone is really committed to making sure that students come back to school. So, I mean, I thank the administrators for that. I know, like Casey, you mentioned, you know, you've got 3 kids at home and it's tough. I mean, you're not a teacher and you still work full time. It puts a lot of stress on families. And luckily I have a student that's a senior at the University of Michigan. So not a lot of stress on me. So, but still she's learning from home. You know, that second piece is what additional staff will you need? It sounds that to me that this group agrees that even if we needed to have additional staff, it's going to be pretty tough to find them and get them employed and screened. And then finally, you know, as it relates to PPE, transportation, and childcare, I just know personally how hard it was for us to find any PPE when this whole thing started. Hopefully it's a lot easier now. And I just have no idea what it would be like to order the quantities that would be required, as noted earlier in the AASA study, to provide, you know, daily masks for 30% of your students. It sounds like an awful lot of, you know, things to have to deal with and to administer and hand out, and it just we have a lot of work to do, but I think we're all committed to getting our students back to school. So thank you everybody for that. And our next town hall meeting will be on July the 15th on 2020 at 1 p.m. So we look forward to seeing everybody there. And this will be available. There will be a link in the next newsletter, which will be coming out next week, Tuesday. So thanks, everyone.
Thank you.
Thanks, everyone. Appreciate it.
Thank you.
Bye now.
Bye.